Hello, I am Marwan AbouRass. The title of this presentation is deeply personal. It reflects my both early dental education experience and my clinical awakening of the true diagnostic power of these two structures, the lamina dura and the periodontal ligament. Like many of you, I learned about the lamina dura and the periodontal space or ligament from textbooks, definitions, often illustrated with idealized x-rays, but rarely emphasize the clinical decision-making power of those two structures. It wasn't until the years later, through focused research, that I found it during the development of my 4R operational diagnosis protocol. Then only I understood the real radiographic and biologic significance of the lamina dura and PDL, LD and PDL. And it elevated the whole system of the 4R. I gave it a whole section, okay? And because of that, I developed the 10 ADI actually, okay? Because of the lamina dura and periodontal space importance clinically, okay? LD is 5, and that's lamina dura and periodontal space. These two landmarks, okay, though small in size, okay, carry significant diagnostic weight. Let me clarify where we are looking at, okay? The lamina dura is only 0.2 to 0.5 millimeters, half, okay, of dense cortical bone lining the socket. The PDL is 0.15 to 0.38 of a millimeter, and it presented connective tissue we know about, which anchored the tooth to the alveolus. Multiple factors influence these two structures. The X-ray image, the root morphology, the number of canals. Okay, there's so many things make them, their image appear differently. So this presentation, okay, is so important. It has 3 objectives, okay? First, I will examine the many diseases and conditions that alters the radiographic appearance of the lamina dura and the ligament. These include endodontic infections, periodontal infections, orthodontic movement, occlusal trauma, luxation injury, extensive restorative procedures. Okay, I will introduce that concept, okay, and introduce something new, the transitional IAP, incisional apical periodontitis, okay, where the lamina dura get disrupted, but it's not endo. The pulp is still vital. Second, I will look at beyond the mouth, okay? We will examine the effects of systemic diseases, conditions, osteoporosis, hyperparathyroidism, chronic kidney disease. They all affect the thickness and visibility of the lamina dura and the periodontal ligament space. These radiographic changes can be early clues, okay? And they help you in diagnosis. The third objective, I will go to healing of the lamina dura and its repair after surgical or non-surgical endo. I have a lot of cases to show that. The reappearance of the lamina dura is a fantastic evidence of healing around the root end. So it's the last thing, when it come back, everything healed. So in these, especially, I have cases, I call them critical size defects, incredible. So this healing occurs regardless of the lesion size. And I will show you some examples of those and how it integrates in your diagnosis. Okay, whether it's cyst to granuloma, forget it. Again, it helps us in decision making, or it's not just a classification. So this presentation is more than just an image review, okay? It's core in diagnosis. And this is where I consider those two areas the most neglected area in dentistry, diagnostics, all right? And I feel strongly about that. It's actually my favorite subject. Okay, let's explore that. Let's go.